What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watch the video, maybe even liked and subscribed, I appreciate you and welcome back. So today I want to talk to you about something that's been on my mind for a while. And I keep seeing these circumstances and comments, and I've talked to friends. And one of the things that I find is that they aren't making their decisions themselves. What I mean is that there is a medical part to this, right? And so the doctors have their responsibilities in this process to give you all of the potential treatment options that you have available. But ultimately, that's your choice. And one of the things that I found is that in talking to some of my friends, they were talking about what they were told to do and not necessarily what they chose to do. And that's important. As we go through and I've set up this channel, my hope is that you're able to make an informed decision on what your care is going to be for prostate cancer, and that you make whatever decision that you make, understanding that it's all bad, but you are picking the outcome that you are comfortable living with, and the bad that works for you. And so ultimately, we sit there, and there are some people who have told me that they asked the doctor or the surgeon, hey, what would you do if you were me? And I'm thinking, one, the surgeon doesn't have to deal with the outcomes. And secondly, and most importantly, they have a dog in the fight. I mean, they're a surgeon. They want to do surgery. Now, it may not be that they're pushing you if you don't necessarily need surgery, but if there's surgery to be had, they're ready to go. And it's the same with the radiation oncologist. I'm sure that if you have taken a consultation about radiation, that you have talked to the radiation oncologist and they've told you all of the advances and all the things that have changed and all the good things that are going on in radiation. And if you ask them, I'm sure that they'll say, you should get radiation, right? You should get radiation. But ultimately, all of them have outcomes. And all of them belong to you. Just make an informed decision. I'm not trying to tell you one way or another. I'm not trying to give you medical advice. And I'm not against doctors at all. I had a great doctor. And he presented me with all of my options. I went and looked at them and I made the decision to have the radical prostatectomy. And I'm hoping that you all do the same. Because ultimately, in the front end, you're going through a lot of things, your brain's all over the place. But ultimately, you have to get to a point where you understand what the other side of whatever decision you're going to make is immediately and long term. Because that's really what the key is. I made my decision based on my age, based on where my Gleason score was, 3 + 4 = 7. I made mine based on looking at all of the circumstances in regards to where it is, where my cancer was, because my cancer was up high and I wasn't really sure exactly where it was. And then most important, while it was still contained in the prostate, and that it hadn't reached the margins. So as far as I was concerned, I was making a decision that was saying that if in fact my prostate cancer was right in the middle, then we're stopping it right here. That's how I made my decision. I'm hoping that you all will look at this channel, look at all of the comments, the concerns, the questions, and then get to a point where you just make a decision that on the other side, you don't have any regrets. Oh, you'll have some, but not a major regret for doing anything at all, because again, doing nothing is an option. Okay? Hope this finds you well. Peace and blessings, folks.